Heart disease is a process that frequently develops over decades and decades of time. Studies have shown that early indications of heart disease can be apparent even in teenagers. So the behavior of young individuals, how they eat, how they exercise, whether they smoke, those things can have an impact decades later. If someone asks me, what are the key things that you need to talk to your physician about, I'd say there are three things that you really need to focus on. First of all, what is my risk of having a heart attack? Your doctor can answer that question based on your cholesterol levels, your family history, your diet, those sorts of things. The second thing that I think is really important to know is how well is my heart functioning? Meaning, am I at risk for a problem like heart failure? And frequently, your doctor can determine that based on a physical examination or sometimes additional tests like an echocardiogram. And then I think the third thing that you need to ask is, what can I as a patient be doing to reduce my heart risk? Changes in your behavior, such as exercising, not smoking, other things that you can do to modify your risk, protect your heart, and stay heart healthy for the rest of your life. There's a lot of exciting things going on in cardiovascular medicine right now. The things that really get me revved up are improvements in cardiac imaging, which are going to allow doctors to identify heart disease earlier, easier, more safely in our patients. Improvements in therapies that are making patients live longer, protecting their hearts from disease and damage. And I'm especially excited about the possibility that we may have stem cell therapies that can even regenerate heart muscle, reversing heart dysfunction and repairing heart back into a normal state. Those are, I think, really three major advances that keep me coming to work every day. It's important to understand how pivotal this moment is in our understanding of genetics as it applies to diseases. You've heard about the Human Genome Project, where all the DNA in a human body was sequenced for the first time. The Human Genome Project tells us what makes us all the same, what makes us all have 2 arms and 2 legs. Now we're beginning to study more and more different human genomes from different people. And we're now learning about what makes us all different. What makes some of us have brown hair or blonde hair, what makes some of us tall, some of us short, some of us run fast, some of us run slow. And the great thing about that is that as we understand the genetics of an individual, we can then make therapies that are specific to that individual, treat that individual better, more specifically, and to give individuals treatments, drugs, other things that will help them and that won't harm them. And that's really, to me, by far the most exciting thing about the application of genetics to somebody who has heart disease. When we hear about celebrities in the news, it's an opportunity for all of us to wake up a little bit, to think about the impact of heart disease, not only on the celebrities, but on ourselves. It's an opportunity for us to think about our heart risk and what it is that we can do to modify our heart risk. It's also an opportunity for us to think about whether we might be having symptoms that are related to heart disease that we might be ignoring or minimizing, and to do something about it. We are hearing more about heart disease, and I think there's good news and there's bad news. I think we're beginning to understand what the risk factors are. We're beginning to understand better how to modify those risk factors. But there's some things that we're lagging behind in. There's more obesity in our society. There's more diabetes in our society. And that's a setup for heart disease if we don't do something about it. I think that we still don't do a good enough job of telling women about the risk of heart disease. When I ask my wife what are the 3 medical problems that she's most afraid of, she says breast cancer, and breast cancer. And yet my wife is 7 times more likely to die of heart disease than she is of breast cancer. Women are more likely to die of heart disease than men. We've got to do a better job of communicating to women the impact that heart disease is going to have on their overall health.